Now, to go back to your kind of point there of traveling, taking this almost leap of faith, I've talked to so many patients over the years that say the same thing. You don't ever get to 100% certainty in anything in life. You could go in for a routine cleaning procedure and not make it out because of some, minor mistake or something like that. So there's never a certainty. What I've heard, most patients get to a 70 to 80% comfort zone where you feel, hey, listen, I feel that what do I have to lose almost at this point? I'm suffering. I need to do something. This is
Hmm.
here. The universe has provided me this route for something. Let me at least go there. If you get yourself to that 70 to 80%, I heard, that is the kind of magic number you go with. And the rest is kind of a leap of faith. And of course, healing's going to take some time. In your case, it was a quick kind of resolution, but I'm sure the healing process after that continues, right? So can you tell us what that
Yes.
was like after the procedure?
Yeah. And, you know, my healing process has been a little slower than some other biological dentistry patients who only have one tooth removed and maybe they aren't as sick to start out. But I kind of started out in this situation in a hole. I had just nutrient deficiencies and really low calorie stores. And because of the pancreas and gallbladder issues, I was not able to eat large quantities of protein and fat. So you need those things to heal. Your body uses those. Those are macro nutrients that the body uses they're building blocks to make bone and soft tissue and vascular tissue. So I didn't have those things in abundance. And my healing was slow. And I was concerned that maybe I was going to get infection. So I did a lot of things to prevent my sites getting reinfected because I didn't want to have surgery again, and I didn't want to have the surgery fail and be sick, have the surgery not do what it was intended to do. So I did intravenous vitamin C. I would get 25 grams. I went twice a week for many months. I went for 8 months, and I just love intravenous vitamin C. It has helped me so much. I would feel great when I would go. Just those neurotoxins would just be, cleared out of my bloodstream, and I would just be giddy almost. And I would talk to people at IV therapy. I would just be talking their ear off. I'm a very social, chatty person anyway. So I did intravenous vitamin C. I tried an infrared sauna at a local place, and I felt that it was going to help me. And I purchased a clear light sanctuary too, and did that at home almost daily for a year. And then I worked slowly on my diet. And the one thing I really tried to do was I had got nutritional testing, and I tried to fill those nutritional gaps that were tested to be missing. But then I also just started taking amino acids since I couldn't eat enough protein, and other supplements like that, B vitamins. But I do a B12 injection every 2 weeks, that sort of thing.
Okay, so you're taking those precautions, you're taking preventive measures to optimize your health, to continue your healing journey. How are you feeling today? How's it, when you look back on this, is this a remarkable recovery? Are you still healing? Where do you feel you are on a healing journey?
I feel my recovery has been epic. I
Yeah.
feel that I'm blessed. I really am excited about my how well I've done. Yes, I healed slowly a little bit, but the results are exactly what I wanted, and the body does what it needs to do in the right time space continuum. You have to kind of listen to your body and give it what it needs. A lot of people who have biotoxin illness will try to push too hard, and they will actually make themselves worse. They try this kill approach, and your lymphatic system gets overloaded and you can't get rid of everything. So maybe I had too many toxins to deal with at one time, and I have to go a little slower. That's okay. I don't mind. I'm happy. I'm able to participate in life and do things with my family and get out and shop and all these sort of things that you need to do. Um, I was recently tested, and I had a GI map assessment done, and I had mold toxicity testing done. And I think that's really important for people who have biotoxin illness. When I get on chat rooms and I see what people are writing, and when people contact me from all over the world, since my story was published. And, a lot of people, um, they don't have the whole picture, and they get the surgery, and it turns out that they have something else that they're also really toxic with, and that hinders their recovery. They have mold toxicity, they have gut dysbiosis with overgrowth of other things in their gut, maybe candida, something like that. They have, there's people who have Lyme disease, Epstein-Barr, and it's undiagnosed. All sorts of things like that. But mold and your gut dysbiosis seem to really affect the recovery of people with biotoxin illness. And I tried to get someone to test me for mold from ever since I had the surgery. I said, well, what should I get? Should I get tested for heavy metals? Should I get tested for mold? And they said, well, you were tested for metals way back when. You probably don't have to get tested for that. We can just assume you have those. And I tend to agree with that a little bit, although you don't know which layer of metal you're dealing with, you're getting rid of. And of course, you could use the better chelation agent. That's a whole other conversation, which we can talk about. I'll talk to you all day about this stuff, but sticking with my story for now. The chelation agents, and things like that people need, they're not getting things in the proper order. So in my case, I tried to get mold testing way back when, and I never had that. And so I would make a recovery. My recovery would go like this, and I would be doing hard cardiovascular work using my EWAT system. I have an exercise with oxygen therapy system. And then boom, I would crash, gallbladder problems, whatever. And come to find out, after my testing this summer, I have mold toxicity. I have ochratoxin A, and Clostridium was elevated. Oh, no, Clostridium is not a mold, sorry. I had ochratoxin A, and I had mycophenolic acid. And then I also, with my GI map assessment, had an elevated candida and Clostridia. Those were the highest ones. I had some others that were a little bit up there, but those are the two that I'm really working on at this time. So now that I am aware that that's the problem, I can bind those mold toxins so that they don't end up clogging up my liver and my gallbladder, and I can keep working out and keep detoxing, and I have the whole picture. And so I think that's really important, because I talk to people all the time and they're so sick. And I'll say, well, have you been tested for this? Have you been tested for that? And some of them have been tested, for none of these things. And they really don't know whether they have those problems or not.